Hey everyone, Dr. Russ here at Desert Brain and Spine. I wanted to review with you some of the different things that we do to reach the desired outcomes for our patients. Now, what I'm sitting on here is called the doc table. The doc table is like the cutting edge in decompression therapy. Decompression therapy, also known as non-surgical spinal decompression, has helped so many of our patients overcome disc issues, degenerative disc disease, facet syndrome, canal stenosis, spinal stenosis, and all the symptoms that associate with low back pain, sciatica, tingling numbness and weakness going down into their legs, neuropathy even. We've just seen so many patients benefit from this therapy because it addresses the root cause coming from the low back. So what I wanted to do with you is just review how this works and why it works. So over here, we have our command center for this table. And what I'm able to do is very simply choose, based on your MRI results, I'm able to choose L5-S1 disc herniation, and the table will move to that position. If I choose, or if you have a disc injury or multiple disc injuries, say L4-5, L3-4, I can change that to a different position and target that specifically. Now, it might seem simple to just lift and lower the table. You're right, it is fairly simple, but it's not that simple in terms of patient efficiency or the effectiveness for each individual patient. So what I will say is I do have certain patients that actually have to go all the way down on their stomach. So they're actually laying face down, and we put them in this position, and depending on what their presentation is, I actually have to either laterally tilt or rotate the table to allow them into the most comfortable and effective position for their disc injury. And so once we get them in that position, you will gently feel the table pulling apart. That pulling apart motion, as you see over my shoulder here, is what creates all of the changes for that disc. Now, the most important piece of this entire puzzle is understanding what's going on, what level, what direction, central, left, posterior, right. It just all depends on your presentation. So not a single person gets on this table until I evaluate imaging and we've got the disc injury diagnosed, or the facet syndrome or degenerative disc disease diagnosed via MRI of the low back. We can do the same thing for the cervical spine, which tracks all of the specific angles here. We can move this up, we can move it down to the most comfortable and indicated level for your disc injury. So if you think that this is the missing piece to your puzzle, please give us a call. We will simply start with just a consultation to see if this is the right place for you. And ultimately, I'm trying to find out if I can accept you as a patient. You have to have these very specific issues and root causes, or I will not accept your case. So if this resonates with you, if you have any questions, please feel free to reach out, 480-674-9199, or via email at hello@desertbrainandspine, and we will get you scheduled for that initial consultation.